Hello, and welcome to our training on neurodiversity and autism. My name is Olivia Bergman. I'm a speech language pathologist at CI, and I'm presenting with my colleagues Emily, Jessica, and Sarah. Our intention of this training is to provide an introduction to the framework of neurodiversity and how we can support autistic people through this framework. So, what is neurodiversity? This is a term that was coined by Australian sociologist Judy Singer back in 1998, and she described that brain differences such as autism, ADHD, dyslexia are not something to be cured, but rather something to be embraced as part of human diversity. Neurodiversity is really a viewpoint that brain differences are normal in human beings rather than being viewed as deficits. And it recognizes that people with these brain differences experience, interact with, and interpret the world in unique ways. What's so positive about this framework is that it focuses on a person's strengths and it works towards greater community awareness and inclusion for all. It helps people to see that while they may have different ways of navigating the world, it's a part of what makes them special. And overall, following this framework can really help reduce stigma around learning and thinking differences and foster more acceptance.
Now that we've touched on what neurodiversity is, let's talk about how it relates to autism. A disorder would be something that needs remediation, such as high anxiety, which negatively impacts a person's ability to participate in their daily routines and community activities. The negative impact is felt by the person with anxiety. It has no positive benefits to the person experiencing it. It is something that needs to change to improve a person's quality of life. Additionally, severe apraxia of speech can prevent an individual from being able to use spoken words to communicate clearly and effectively, which impacts their ability to make wants, needs, emotions, and ideas known by others. Again, this impacts the person with apraxia of speech negatively, and they may need to seek other means of communication. A difference is a natural variation amongst people. For example, some people enjoy friendships that are more reserved and share more factual information to feel a certain level of closeness, while others enjoy friendships that divulge highly emotional experiences and information to feel connected. Neither is wrong. Some friends can talk for hours and be content, while others would prefer to have an activity-focused social interaction. It is all a matter of preference and personal differences, much like the color of one's hair and the unique ways of experiencing the world and the likes and dislikes that people have. So now that we know that autism is a difference and does not need to be cured, we can understand that it is a part of somebody's identity. Every person has a unique knowledge base filled with personal experiences that help shape who they are and their perception of the world around them. Autistic people don't need to be cured of their autism because their autism is part of them and helps shape the way they experience the world and understand the world, which can be extremely helpful when approaching a problem because somebody with different world experiences can help you approach it from another angle. So autism is a part of somebody as much as any other personal or visible difference, such as being male or female, black or white, or being a visual, auditory, or tactile learner. We know that there is no right or wrong way to learn. Some children may prefer to look at an item very closely to see every minute detail. Others may prefer to rub the item on their face to experience every texture the item has to offer. Neither way is better or worse than the other. Each way is allowing the child to experience an item or toy in a way that speaks to them and ultimately allows them to grow and learn. So, how are we going to support neurodiversity? We want to promote success and self-acceptance. We want to focus our efforts on seeing our autistic children and students for who they are as people, with desires, ideas, and dreams, and rights to the supports they need to be who they want to be. Our autistic students need a more accepting society that gives them equal opportunities as any neurotypical student would have received. When we celebrate our autistic students, we are allowing them to develop a more positive self-identity. Many of the barriers faced by autistic people arise not from the condition itself, but from society's lack of acceptance for people with differences. So, how do we help tear down these barriers? How do we provide accommodations and support so our students can not just survive school, but thrive and have a fulfilling life?
Another way that we can support neurodiversity is by reframing the language that we use. The way that we talk about autism can unintentionally be harmful to autistic people and imply that autism is a bad thing. Changing the words that we use is a simple way we can support our autistic students and children. We want to think actively about how we talk about autism and describe autistic traits. So firstly, let's attempt to describe autistic traits with strength-based language. This means focusing on things that our students and children are good at and speak in a positive manner about autistic traits. So change the words that you are using. As opposed to saying nonverbal, you can say non-speaking, because if we are accepting that their forms of communication are equivalent to verbal communication, they just don't speak to communicate with us. As opposed to saying rigid, we could say prefers consistency. As opposed to saying obsessed, we could say passionate. Another way that we can reframe our language is thinking of person-first language versus diagnosis-first language. So, is it a person with autism or is it an autistic person? Studies have found that a majority of autistic adults preferred being called autistic. And this is solely because autism is a part of their identity. They are autistic, they are not a person with autism. When describing an autistic person, never say that they suffer from or are afflicted by autism, because that implies that they are suffering. When in doubt about how a person prefers to be referred to, always ask. We also want to move away from functioning labels. The science that functioning labels is based on is now significantly outdated. Functioning labels do not paint an accurate picture of the person's abilities and can put them in a box of, if you are low functioning, that means that you are not able to do a lot of things, which is not necessarily true. And there is nothing wrong with needing more supports in order to be successful in a variety of different environments. This tweet here is a great way to think about functioning labels. So imagine if ASD was described like types of cupcakes. You have some with icing, some with sprinkles, some with chocolate, some vanilla, but they're all cupcakes. But how cupcake is it? What? Like, is it a little bit cupcake or is it severely cupcake? It doesn't work like that. And just like cupcakes, autism does not work like that. You are not a little bit autistic or severely autistic. You are autistic, and all autism looks different. Providing unrestricted access to supports is another way that we can be neurodiversity affirming. Some students or children may need more supports or tools in order to be successful across different environments. At home, where they are comfortable, they may need less supports, whereas in school, where the demand is higher, they may need more supports. Restricting these access to supports can impact success across environments. Imagine you had to take the SATs, but you don't get a pencil or a calculator. For our students, these supports can include an AAC device, a fidget, a chewy, headphones, anything that makes them feel more comfortable or able to sensorily regulate so that they can focus. Again, reframing our language from these being toys to being tools and things that they need in order to be successful. Now we're going to talk a little bit about presuming competence. So to presume competence is to assume that autistic people have the ability to think, learn, and understand. Oftentimes, because of the diagnosis of being autistic, there is an assumption that they cannot think, understand, or learn like everybody else. Presuming competence allows them to, instead of meeting a predetermined expectation, it lets them enhance the skills they already have. So instead of saying you are expected to behave like this, it is again a strengths-based way to look at a person who is autistic and say, okay, these are your strengths and we are going to enhance those. This is moving away from the framework of no you can't to yes you can. So some do's and don'ts to support presuming competence in an autistic person. Do talk to your child normally. Often we talk down to them or like they are too infantile to understand what we are talking about. Talk to them like they are a person who can understand the concepts that you are discussing. Do find ways for them to communicate. Sometimes they may need more support or may communicate in different ways, but all communication is valid communication. Do listen to what they are saying or trying to communicate. Again, this involves looking for clues or trying to seek understanding because they may be attempting to communicate, but not in the way that you are expecting. And don't withhold information from your autistic student or child for fear that they will not understand. You cannot attempt to understand something until you have been exposed to it and had an opportunity to learn about them. So do help them learn and understand the information that they are being presented with. So the next thing I want to talk about is play. And this is because at some point, a lot of our autistic students and children have had a goal written by one of their therapists for targeting play and how they play. But as we are trying to be more neurodiversity affirming, it is important to recognize that play is play. And play is defined as engaging in an activity for enjoyment and recreation rather than for a serious or practical purpose. So all we should be judging play by for our autistic children is, are they having fun? Are they finally taking a break from all the things that they have to do and engaging in recreation? If yes, they are playing. So in order to be more neurodiversity affirming, we should try to move away from treating play, since there is nothing there to treat. Because if the child is meeting the expectations for the definition above, they are playing. That also means we should stop trying to change their play and make it different. Our autistic children will inevitably play differently from their typically developing peers. Their play may not look like what it is expected to look like, but that doesn't mean that we need to change or adjust it because there is nothing inherently wrong with it. Which brings me to my next point, is moving away from labeling play as wrong. There is no wrong way to play, just like there is no wrong way to pretend. If you are engaging in something that brings you joy, whether you are using the toy the way it was designed, whether you are interacting with another peer or just playing by yourself, if you are getting enjoyment out of that, you are playing. And it's important to support our autistic children in finding things that bring them joy and bring them recreation. And play is all about having fun. Another way to support the neurodiversity affirming movement is by listening to autistic voices. So this means listening to members or following members of the autistic community who speak about their autistic experience and advocate for the needs of themselves and other autistic individuals. So in order to listen to these voices, we need to be active listeners. So we need to actively seek out this information, and they take the time to listen to what they are saying and respect what they are saying. Some ways that we can do this, other than talking to autistic individuals that we know, is by following blogs, going through social media, or pursuing continuing education taught by autistic leaders. It is important that we respect autistic people are the experts on their autism. And we need to respect when autistic people set boundaries, as it is not their job to educate us about their experience. They are allowed to do that when they choose to do so, but they are not responsible for educating us about autism and the autistic experiences. So seek out resources that are available, but do not expect that people you know who are autistic will educate you. Other ways we can support neurodiversity is providing autonomy. So this means allowing our autistic students and children to make decisions regarding their treatment, body, and self whenever possible. A great example of how to do this is to allow them to take an active role in establishing goals for their treatment. Something else we can do is enhance skills. Move away from trying to reduce deficits or make students seem less autistic. Allows for them to engage in activities that enhance the skills that they have, lead to natural learning opportunities, develop social connections, and support overall well-being. Great ways to do this are allow children to talk about their interests, to explore what they are interested in, and to engage in interactions that they choose to. When they are engaging in those interactions, they are developing true social connections versus forced and uncomfortable ones. And by allowing them to be their authentic autistic selves, it supports their overall mental health and personhood. And lastly, communication. This means we attempt to understand and honor all communication styles and attempts.
Now that we have learned how we can support neurodiversity, we are going to take a look at how we can understand and respond to autistic communication styles. We are going to talk about some forms of communication that autistic adults have identified as common communication styles. The first is information dumping. This is a communication style that can be characterized by talking a lot about a topic in great detail. A person who is information dumping may share extensive knowledge about a topic, overlap speech during the conversation out of excitement, or redirect a conversation to their special interest. Echolalia is the repetition of sounds, words, or phrases. For example, you may repeat a phrase you've just heard, repeat a line from your favorite movie, or repeatedly press a button on a device which elicits a sound. Immediate echolalia refers to repeating something that you've just heard, whereas delayed echolalia refers to repeating something minutes, hours, days, or even weeks later. Delayed echolalia may seem out of context. Direct and literal statements. Many autistic individuals have stated that they value honesty. This means their language may feel more direct. In an article written by an autistic adult, he suggests that you should avoid using imprecise language like perhaps, possibly, soon, when speaking to an autistic individual. You may find if you use this language, they will question you for more specificity. Limited small talk. In the same article, there is reference that autistic individuals place less value on small talk and discussion of traditional topics. Rather, the conversation may start with a hello or similar greeting, but there is usually no other small talk. You can expect generally that the conversation will go straight into the meat and bones of the interaction. And lastly, we have nonverbal cues. This may be the most common to us, and that is difficulty reading body language, facial expressions, or tone of voice. It is not always the case that autistic individuals can't interpret these cues, but rather they may not feel confident that they have interpreted them correctly. This is another reason why direct and literal language is important. Additionally, it was suggested in these articles that you should not pay too much attention to the body language of an autistic individual. Rather, again, focus more on the literal meaning of words. If we look at all of these communication styles, they all serve a similar function, which is to build and foster connections. When looking into autistic communication styles, you may learn about the double empathy problem. In an article written for Spectrum News, Rachel Zamzow explains the double empathy problem. She explains that this is the basis of the theory that if there is a mismatch between two people, faulty communication can occur. This disconnect can occur at many levels, from conversation styles to how people see the world. The greater the disconnect, the more difficulty the two people will have interacting. In the case of autism, a communication gap between people with and without autism may occur not only because autistic people have trouble understanding non-autistic people, but also because non-autistic people may have trouble understanding them. The problem is, the theory posits, is mutual. For example, difficulty in reading the other person's facial expressions may stunt conversations between autistic and non-autistic people. If we look at the picture here, we see the neurotypical perception of different communication styles, and it can be helpful to change our mindset when we see this. So, if we're thinking, for example, that you ask a person, "Do you like my haircut?" and they respond with no. What is your initial thought of the person? Would you perceive them as rude or blunt, or would you perceive them as honest? If we're looking at this chart, we can see a lot of examples of how we could change our mindset. Rather than someone being intense or obsessive, we could say that they're passionate or deeply informed. Rather than weird, they may not lack why certain social behaviors are important. I won't go through this whole chart, but we can see by how changing our mindset of different perceptions that we have can help us be more neurodiverse and affirming. In this picture, we have an example of what an autistic person may think about and experience when they are having a conversation. We see the person on the left saying, "Hi, how are you?" The person on the right isn't sure how to respond, and they end up responding with something about a train. If we look through this whole thought pattern, we can see that they're feeling overwhelmed. They're trying to interpret hand gestures, facial expressions, body language. They're trying to maintain eye contact while also trying to think about how to provide an answer. If we think about the previous few slides, we can think about how interpreting body language and nonverbal cues can be tricky for autistic individuals. If we take away some of those communication expectations, such as maintaining eye contact, having a calm or still body, we can take some of those communication demands away. This can help have more meaningful and impactful conversations while also supporting autistic communication styles. How can you respond to echolalia? If we go back and think about how every person has a unique knowledge base, we can use echolalia to understand that person's knowledge. We can recognize that echolalia is an attempt to communicate with you. We do not always need to take the scripted comment literally. There may be an association between the script and the conversation that you're having or the environment that you're in that you don't understand, and that's okay. What we need to do is acknowledge the communication attempt, even if we aren't clear on the meaning. When we hear someone who is using echolalia, we should take that as a sign that they are trying to communicate with us, and we should respond in a way that we would respond to any other communication.
So we asked some of our autistic clients what having autism means to them, and they shared the following. And as you can see, every individual's experience is unique and really highlights our need to explore each person's strengths and areas for support. If you're interested in learning more about neurodiversity, you can check out some of these resources below. Thank you for watching our presentation. We hope it was informative.